Namaste viewers, welcome to the Facebook live session. As we celebrate today World Kidney Day, our topic for discussion is kidney diseases, its causes and treatment options. And for our discussion, we have with us Dr. Sanjay Maitra, Senior Consultant Nephrologist at Apollo Hospital, Jubilee, Hyderabad. Dr. Sanjay Maitra is having an experience of over 27 years. Welcome Doctor to our Facebook live session. So coming towards our questions, so doctor, could you please tell our audience why do we celebrate World Kidney Day every year?
Good afternoon everybody. It's been really a pleasure to be here with you. Today is World Kidney Day, a very special day for all of us nephrologists. And the answer to the question is very appropriate. Why is World Kidney Day celebrated? Now coming to the point about it, it was gradually realized that the awareness about the causes and the various facets of kidney disease is generally lacking in the public and amongst the community. So starting way back in 2006, the International Society of Nephrology along with the International Federation of Renal Physicians came up with this plan that every year the second Thursday of the month of March would be designated as the World Kidney Day to focus on a single aspect of kidney disease. Now this year the focus or the theme has been that the World Kidney Day this year would be that it is kidney disease what you need to know, or the kidney health for all. Basically to bridge the gap in knowledge amongst the community, amongst the medical fraternity, and even including the administrators, so gradually to deliver kidney health to all of the people who need it. So coming to the point, each year, like for example, one year they focused on women's health problems of kidney disease, one year pediatric, then gradually the awareness of fruits, vegetables, healthy living, exercise, etc. And various years the topic is changed. So this year it is to increase the awareness about kidney disease and see that we deal with this problem together.
Okay. So can you tell us a little more about the basic type of kidney diseases and the type of kidney failure a person can experience?
Definitely. See, kidney disease is not a lump sum thing. Basically, as a nephrologist, without getting you confused, now there are some basic categories of kidney diseases, and I'd mention a few. Like for example, nephritis, what we call acute nephritis, and nephrotic syndrome, where there's a lot of proteinuria coming out in nephrotic syndrome. In nephritis, mainly in children, it happens mostly in children. There is blood coming out in the urine, there is swelling of the feet and face, there is high blood pressure, and there is generally an association between a sore throat or a streptococcal infection in the throat or of the skin. Now coming to the kidney failure, basically there are two types of kidney failure: acute kidney injury and chronic kidney disease. And the reasons are of these presenting as acute kidney injury and chronic kidney disease is completely different. I just want to caution my viewers that for today, whenever we are saying kidney disease, we basically mean chronic kidney disease, which is a process of gradual, progressive and irreversible failure of the kidneys. And the causes of these are basically, most importantly, diabetes, high blood pressure, obesity, smoking, and I'll elaborate more on that. The reasons for acute kidney injury definitely would be something like severe diarrhea, vomiting, nausea, low blood pressure, shock, and some medicines which can give rise to this. So there are other causes of kidney diseases also, like a urinary tract infection or obstruction, stones, cancers, etc. But that's not the focus of my talk today.
Okay, so how would I know if I have a kidney disease?
Basically, see, all patients, it is possible that you may have a kidney disease, but some groups are at high risk. And particularly I'd like to mention people who are elderly, like more than 65 years, are definitely more likely to have kidney disease. People who are young but who are obese, smoke, have high blood pressure, diabetes, take painkillers or off-the-counter medicines, have addictions, and definitely take indigenous medicines would be the category I would go for. In addition to this, people who do not exercise, who eat all sorts of junk food, take very little fruits and vegetables, are particularly prone to this. Now, coming to the point, how will I know this? It's very easy. One is, periodically you need to get yourself just to pay a visit to the doctor, maybe once in 6 months or once in a year, and do some basic checking. Like, for example, get a blood pressure checked. If there is high blood pressure, then definitely you are a little bit more prone to develop kidney disease sometime later. I'm not saying it's a certainty, but it's a possibility. Secondly, if you do a urine examination to look for proteinuria or RBCs or any other abnormalities, then it is a possibility. Third, the creatinine, the serum creatinine, if it is above the range prescribed, then definitely it is showing that the kidney function is not very good. Now, suppose you have some symptoms of, let us say, swelling of the feet, swelling of the whole body, then definitely it's an indication blood coming out in the urine. You have fever, loin pain, and if features suggestive of urinary infection, you are more prone to develop kidney failure later on.
So, what are the common causes of kidney diseases in our country?
The most common causes of kidney disease in our country for adults, I'm not including pediatric group in this discussion, is generally of CKD is diabetes, hypertension, some cases of glomerulonephritis, and one group has recently been coming out is definitely CKD of unknown etiology. It is called by various names, Codaguram nephropathy, the Mesoamerican nephropathy, etc. But it is basically an interstitial nephritis. There could be other causes like pregnancy-induced, stones, cancers, drug-induced, but they are not the prime ones.
Okay, so what are the symptoms of kidney disease?
Unfortunately, in the initial stages, there are very few symptoms of kidney diseases. And that is why in the initial part, when the disease is not very severe, it gets missed easily by the patient and even at times by the doctor. So what happens is, initially, I'll tell you what, there could be some high blood pressure which the patient does not record. He has some swelling of the feet which he ignores, takes a medicine going to the over the counter, maybe a water pill, and the swelling comes down, so it gets ignored. Later on, when the disease progresses, that's when the GFR is below, I would say, 60 or more, so 45 or lesser, then the problems start. Like, for example, anemia starts developing. There is evidence of renal osteodystrophy or MBD, like mineral bone density, aches and pains of the body. There could be weakness. There could be a lack of appetite, and in severe renal failure, patients may have a very low appetite. He can have vomiting, nausea, shortness of breath, extreme weakness, itching, bleeding tendencies, encephalopathy, etc.
So, doctor, what drugs are harmful to the kidneys?
Generally, see, any drug, I would request my audience to find out with your doctor to make sure that it does not have any harmful potential for the kidneys. However, certain drugs are particularly dangerous or damaging to the kidney already if there is previous damage. Now, the ones which have been most important are the painkillers. We call them non-steroidal anti-inflammatory drugs, like, for example, Brufen, like Combiflam, common ones which we use, NICE, then Voveron, all this. Diclofenac, what I mean, then ibuprofen, then the other ones is Hyphenac P, etc., etc. They all come under the category of non-steroidal anti-inflammatory drugs. So these are particularly harmful. Certain antibiotics, like, for example, aminoglycosides, are harmful to the kidneys, like gentamicin, amikacin, netlomycin, etc. Cancer drugs and certain drugs, antiviral drugs, are also have harmful potentials. One of the things which is commonly done is iodinated contrasts have also to be taken care of, particularly in a damaged kidney, and appropriate precautions have to be taken. Indigenous medicines also have potential, and you should avoid them at any cost if you have any chance of having CKD.
So doctor, how can I protect my kidneys if I have to take medicines to treat another health condition?
The first thing is you need to be aware whether you have a kidney problem or not. That's the whole thing. So if you don't know, and I said it's very easy to get it done, you need to go to your physician or your doctor, tell them that you need to find out whether, and it is very easily done. Just checking the blood pressure, looking at your blood pressures, your blood sugars, your doctor will do that for you. And just focusing on the kidney function, I would say a creatinine and a urine examination will be a reasonable guess at whether you have some underlying kidney problem. Once there is a doubt, further tests can be done, like for example an ultrasound, and the other more important tests like a hemoglobin, creatinine, calcium, phosphorus, etc. that will follow. But as a screening test, I want to emphasize just a blood pressure recording, a urine examination, and a serum creatinine from a good lab is enough.
Okay, so coming towards our next question, what food should I avoid to keep my kidneys healthy?
See, there is a lot to say about this, particularly with the urban lifestyle and the jet set lifestyle. There is a complete disbalance or unbalance about the food which we are taking. Whatever is home cooked food, no processed food, that should be the focus. Junk food should be avoided. Any of these foods which we go eat, frozen dinners, all this has to be avoided. I'm not telling you to take a bland diet. What I'm saying is a food which is balanced in terms of nutrition, like carbohydrates, fats, proteins, minerals, vitamins, fibers, everything, fluids. This is a basic thing. And whatever we ate, a generation or two ago in the villages or our elders ate, cooking at home would be something good. I would definitely emphasize, I'm not a big fan of saying restrict the protein, take adequate amount of protein, and believe me, vegetarian sources of protein are equally good and can be used without much fear. It is not that you have to take non-vegetarian food to have a protein. Eat plenty of vegetables and fibers and do healthy lifestyle changes, like for example exercise, do whatever you enjoy to exercise. Go ahead.
So, how does aging affect the function of the kidneys?
As everything, whenever your body ages, your kidney ages too. So generally, the thumb rule is that above the age of 40 years, every decade, we lose around 10 ml of GFR. So by the time you reach around 60 or 70, you are all by definition on CKD, because your GFR, estimated GFR will be around 60. So you definitely, above the age of 65 and maybe 70, some say even 60, you are more vulnerable to have further damage in the kidney, because your GFR or your kidney function is just hovering in the area where it is more prone to damage. So this is the whole thing.
Okay. So how does my doctor knows if I need to have a kidney dialysis or get a transplant?
One thing is very clear, in chronic kidney disease there are 5 stages, and we do it basically by 2 aspects. One is the GFR criteria and the albumin criteria. Without confusing you, for detecting or for diagnosing whether you need dialysis, you need to have a high serum creatinine. In technical terms, I would say your GFR ideally needs to be less than 15 ml per milliliter. Of course, that's not the only criteria, and your doctor will know more about it and tell you appropriately. The only thing we need to do is, I'm talking of CKD, we need to make sure that this kidney failure is not reversible. Like if suppose there is an obstruction, you remove the obstruction and the kidney starts functioning. That cannot be the case. So once we are sure, we means the doctors are sure that there is no reversibility of the kidney function, or the patient has some complications, a dialysis is ordered. Now coming to transplant, we have to make sure from our workup what is the cause of kidney failure, and once everything has been sorted out, there are no other issues to deal with, like for example an underlying cancer, very poor heart, a severe damage in the lungs, anything else, a liver damage, etc., etc. Once that the doctor knows has been cleared, then he will offer you a kidney transplant provided a suitable donor is available and the patient receiving it is fit.
So doctor, what are some ways to protect the kidneys?
This question is very commonly asked to me by my patients, and I have a quick fix way for dealing with this. See, presuming that the patient or the concerned person is asking about chronic kidney disease, I would say because diabetes and hypertension are the most common causes, I have restricted myself to this only. So any patient, and you will see any patient of chronic kidney disease, certain things have to be done. One is control your blood pressure. I am talking of adults. The value which is most commonly recommended of blood pressure control is less than 130 by 80 is the initial target. And if better still, it would be around 120 by 70. So try to keep your blood pressure below this level. And it doesn't matter how many medicines you are taking, the target is very important. The second thing to take or talk about is that the sugar should be appropriately controlled. That is, the HbA1c, the 3 months average of blood sugar, should be below 7. And if the person is young, let us say below 60, and there is no heart disease or anything else complicating factors, I would recommend that the HbA1c should be 6.5. There should be a proper control of the cholesterol, which your doctor can do with a healthy lifestyle as well as medications. It is appropriate for patients not to smoke. CKD patient cannot afford to smoke ideally. Fifth is, do not eat too much of non-vegetarian food. Don't get me wrong. Take around 0.6 to 0.8 grams of kilogram of gram per kilogram of body weight of proteins. You can have a healthy mix of non-vegetarian and vegetarian proteins. Avoid red meat though. I would recommend that. Avoid alcohol definitely. Do not smoke. I think I have told you already that. And do not eat plenty of fruits and vegetables. However, be careful with your phosphate and potassium content. Avoid all tinned food or packaged foods as much as you can. And lastly, I think you should exercise regularly. And there are certain guidelines, 40 minutes, 30 to 40 minutes of daily medium intensity exercises for 5 to 6 days a week. The second phase deals with what not to do. Do not take any over-the-counter medicines whose side effects you are not aware. Do not avoid painkillers. There are painkillers which are safe. Talk to your doctor. Do not take any medicines which are harmful to the kidneys, particularly antibiotics. Inform your doctor who's giving the medicines that you have a kidney problem and it will be dealt with.
Okay. So how long can a person live with chronic kidney disease?
Well, that's the answer to this question I wish I knew. Depends on which stage of kidney disease you are in. Suppose you have a mild kidney disease, CKD stage 3 or 4, definitely if you are disciplined and if your blood sugar, blood pressure, etc. is well under control and there are not too many complicating factors like, for example, a heart failure or a bad lung or an infection, something, you can expect to pull on like this for a long time. But let me remind you that chronic kidney disease by definition is definitely a progressive and an irreversible condition, though it is gradual. Now, suppose somebody has an advanced kidney disease, what I mean is CKD stage 5, and he or she is not on dialysis, then the general understanding is that the patient goes into dialysis or needs dialysis maximum by a year or year and a half. That's the understanding. Now since this question has been asked to me, there is always a comparison between dialysis and transplant when the patient has already reached end-stage renal disease. Now, dialysis are of two types, hemodialysis and peritoneal dialysis. I'll just give you the data. If you believe the worldwide statistics, peritoneal dialysis is said to have a better outcome in the first 2.5 years of dialysis initiation. Hemodialysis catches on later. Between dialysis and transplant is way better in terms of the quality of life, mortality, and the outcomes, even the cost. This is initially a little difficult to swallow, but generally by 1.5 years to 2 years after a successful transplant, the cost equals, and then since then the transplant is always a cheaper alternative to monthly, regular dialysis, or what we call as maintenance hemodialysis.
So doctor, in the near future, do you think that the outcomes or the results of kidney disease treatment will be getting better?
Yes, I'm quite positive about it, because gradually, though slow, even in Government of India there has been a sort of awareness. Non-communicable diseases are important, and what I understand from the newspapers and the TV channels, what is saying is the government is setting up very aggressively a non-communicable disease management cell in the Ministry of Health. Over time, if we have that infrastructure and the sort of information percolates to the population, I am sure there will be a little better experience in terms of food, exercise, so diabetes control, hypertension control, indigenous medicines, etc. Now the second point to this is that there have been recently a couple of very interesting medicines in diabetes control which have gone beyond their limits. One is the SGLT2 group of medicines, what we commonly know as empagliflozin, dapagliflozin, canagliflozin, etc. And the second, the GLP-1 agonists, which have shown much more benefits than what they were originally designed for. Besides sugar control, they have been found to be good for the heart, good for the kidneys, good for the liver, good for weight control, good for BP control. So almost a panacea. They are a little difficult to use, but I think science or doctors will gradually learn how to use it, and the results would be better. It has to be a multi-pronged approach. We have to start early. We have to deal with childhood obesity, we have to make better awareness, we have to control the industry. So it is going to take time, but I am sure the future is bright for the management of chronic kidney disease later on.
So coming towards the audience questions, so how much amount of water one should consume every day to keep their kidneys healthy?
Basically, in an adult, I would say around, don't talk of extremes of weather conditions. What I mean is, considering that we are at Hyderabad, these sort of moderate temperatures, generally depending on your physical exhaustion, or if you are a marathon runner, you need to drink more. But generally, a sedentary person, around 3 to 3.5 liters of water or liquids in 24 hours should be enough.
So can a kidney disease be cured?
Depends on what you're talking of. Like, for example, there are certain kidney diseases, and that's why I initially classified, like, for example, the nephrotic syndrome. Some nephrotic syndromes respond very well, like minimal change disease, and we can cure them. There are other conditions also, rapidly progressive glomerulonephritis, acute kidney injuries, which I said. Suppose one has a bad diarrhea and dysentery or infection, and he goes into renal failure. Properly treated, this patient can recover. Chronic kidney disease, as I told during my talk, is gradual, progressive, and irreversible. Though it cannot be completely prevented or reverted, I think it can be well controlled if the patient and the doctor have spotted the problem early and have worked aggressively towards reverting the condition.
So coming towards our last question, doctor, please tell our audience about the facilities provided at Apollo Hospital, Jubilee.
Well, we are a big nephrology presence here. Let me tell you, we have 6 nephrologists here, 4 adult nephrologists, 1 junior consultant in nephrology, 2 pediatric nephrologists. We have a very, I would say, efficient dialysis unit. We do all sorts of dialysis. We do maintenance dialysis, we do acute dialysis, we do SLED, we do CRRTs. We have a very robust pathology backup, a wonderful blood bank backup. We have a very strong immunology laboratory, which both our laboratories, like the pathology laboratory and the immunohistochemistry, is very respected throughout the twin states of Andhra Pradesh and Telangana, and we get many referral samples here. We have transplant surgeons, we have liver surgeons, across the spectrum. So we are a big presence here. We do all types of nephrology practice, like for example clinical nephrology, acute kidney injury, dialysis, transplant, ICU nephrology, etc., etc., plasma exchange, name whatever, we do it here.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Sanjay Maitra and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Thank you very much.
Thank you for joining us. Stay